surprise to anyone in this room that I believe that the challenges we face at Valley View are at the crux of our financial challenges we face as a county. And unless we take tight hold on the reins, we will be heading down a path towards bankruptcy. We're not there yet, but we'll be heading down a path. But that's not what's going to happen on my watch. And the legislators, you should not let it happen on yours either. And we're not in this alone. At least 15 other counties in New York State are reviewing their options, just like us. 3 have recently sold. You can see that list. That list is as new as yesterday. How many are reviewing? How many closed? And how many sold? We're not alone. I don't see Orange County up there all alone on that sheet. It's everybody. So you can look at that 2 ways. You could say, Orange County, are you right to fight to not do that? Or are you wrong? And that will take you down a path that you don't want to go. Or you can say, yes, with everybody else, we have to look, and look hard, and look quickly. Not delay. Delay doesn't do it. 3 sold. 4 closed it. That's a travesty. That's a travesty. Closing. Every day when we view the news from around this state, we find news stories about counties plagued by challenges with their own nursing homes. Look at the list, ladies and gentlemen. Just look at the list. I don't have to read it. You can read it for yourself. It's telling. It's across the state. It's in many newspapers. That's the truth. If you believe the paper, that's the truth. That's the truth. And legislators had every one of them. I sent it to their boxes. Every one of them. Suffolk is working towards privatization of their home. They just really sold it. They didn't have a buyer. As is Ulster County. You know who called me on the phone to make that? Mike Hine called me. We discussed it for hours. And now they've sold it. They have a buyer. Because the legislature and the county exec came together. Dutchess County already sold theirs years ago. Mr. Steinhaus told me it was the smartest thing they ever did financially for their county and for the residents that reside there. Westchester closed years ago. Westchester, 4th largest county in the state, closed it. Rockland is exploring their options. They're borrowing money in Rockland to make payroll. We're not going to borrow money in Orange County to make payroll. They are. Last week, a state panel backed the health department's recommendation to reject Albany County's bid to build a new 200-bed nursing home. And you know why? They said they didn't have the wherewithal to pay for it. And they denied it. And just this week, we received notification that Steuben County put their 105-bed nursing home facility on the market, a facility that's less than 5 years old. They built it 5 years ago. That's why we put that up. It looks pretty beautiful to me. And they built it 5 years ago. And what they do this week, put it up for sale. Put it up for sale. Built it 5 years ago. But realize you just cannot sustain it. That's pretty telling to me. Fact. New York State no longer wants counties in the business of running nursing homes. They've been telling us that for decades. They want governments out of nursing homes. They don't want publicly run nursing homes any longer. In a nation, there's only 6 of publicly owned nursing homes nationwide. In New York State, there's 36, and there's 14 or 15 doing other things, and there's over 600 profit or not-for-profit nursing homes in New York State. What's that tell you? There was never more than 62, and now we're down to half and going to be less than that. For a public entity, they are extremely costly to operate. Recent events, however, have unsuccessfully left some residents and their families feeling uncertain, and I feel for them. Every day, they're on a roller coaster ride. The residents, their families, and also the workers that work there. They're on a roller coaster ride. We're selling, we're buying, we're keeping it, we're putting money in, we're not putting money in. Make a decision. The challenges faced at Valley View should have come as no surprise to anyone who has been paying attention. If you're paying attention and reading, you cannot be surprised. Valley View administrative staff regularly reports to the Legislative Oversight Committee every month. They come in and they tell you. In 2003, I sent a letter to Valley View residents and family members, alerting them to the financial challenges we face. And I'll read this whole letter. Every legislator had this letter in 2003. And there's more to the letter, but I'll read something that's very clear here. Our residential health care facility currently costs county taxpayers $51 million per year to operate. Of that, $9.1 million comes from locally raised taxes. That's roughly 12% of all the taxes Orange County government collects from residents. If we continue to follow the trend, by the year 2010, the county's taxation costs of operating the facility will be $20 million. I missed by a year. In the year 2 years. In the year 2012, it cost this county $19.6 million. And that's a fact of county taxation. That was 03. The residents read it, the staff read it, the legislature read it. So for them to say, some of them, we don't know anything about this, try reading. In 2005, at a meeting of the full legislature, Resolutions 116 and 117 received unanimous approval by the legislators, unanimous, of the 19 that were in the room that day, many of whom continue to serve in this legislature today. They should be thrilled about that. But here's what it says. Let's explain what they read, were supposed to, and passed unanimously in 2005. So 2003 a letter came, 2005 resolutions they passed. These resolutions urge the governor and the legislature of the state of New York to enact legislation providing for adequate reimbursement for county nursing facilities. Permit me to read you just a few lines from Resolution 116. Whereas today the Valley View Center for Nursing Care and Rehabilitation is facing a financial crisis. And whereas, like public nursing homes statewide, the Valley View Center for Nursing Care and Rehabilitation is being financially hurt by spiraling employee health and retirement costs, as well as a decrease in the number of private patients, and whereas even more significantly, the county taxpayers are being victimized by the Medicaid rate system that in effect imposes an additional tax burden on local residents for the services Valley View provides to those in need. And whereas the state imposes its extra tax by establishing Medicaid rates at a lower level that is impossible to provide nursing services to those in need for the amounts allowed, even with the most aggressive cost containment measures being imposed by the county administration, it goes on and on and on and on. I'm happy to give those resolutions anytime you want to read them, in full. But that's what this legislature passed in 2005. They didn't know, though. They don't know. Let me repeat. It was approved by all 19 legislators present at the meeting, 19-0, unanimously. They read a letter in 03. They passed resolutions in 05, but they didn't know. In 2007, presenting the 2008 budget, I told you that the cost of the county to run the Valley View had hit $1 million per week, that we must continue to seek efficiencies for the facility. In 2008, in response to the findings of the Berger Commission, started by Governor Spitzer, we were forced to eliminate 160 beds and close the Perry Building. State statute, not Orange County decision. State. Close it. Despite the considerable reduction in census capacity, we were able to keep the Perry Building staff on until it became necessary to eliminate 39 positions at Valley View in October of 10. So for 2 years, we kept on 40 people, when I probably should have made the hard decision in 08 and not kept them on, but I did. But I don't care for the workers. No. Soon after, at a cost of $143,000, the Orange County Legislature commissioned CGR's report, the Center for Governmental Research, an independent and nonpartisan agency to conduct a comprehensive review of the current operations of Valley View, a historic analysis of its financial condition, and the county's role in providing financial support. A benchmark comparison of Valley View to comparable facilities and a detailed analysis of various options involving potential changes along a continuum of internal changes to the county from ownership of the facility, as well as recommended for the best solution for Orange County, the nursing home, its residents, and the staff that work there. That is what they were commissioned to do by this legislature, signed by me, at a cost of $143,000. The final report was issued to the legislature and to myself, August 2011, a year ago. 133 pages long. The report was provided to all legislators and posted on the county-wide website immediately. Allow me to read a few excerpts from the report, because giving it to them doesn't mean they read it. We read it. From page 122, such an outcome would require significant changes in the current staffing, would require significant changes in staffing, salary, and benefit structure of the nursing home, along with numerous other changes, as well as being contingent upon the creation of a separate bargaining unit for Valley View employees alone, separate from the countywide CSEA bargaining unit, because it's a healthcare facility. It's not a county workforce. It's a healthcare facility. It's very different. You can't have the same bargaining unit doing both. We have asked for years. Every negotiation starts with, please, let's separate the units. The answer is emphatically no way, no how. But they want to help. From page 123, the CGR's primary recommendations. This is their report, not mine, not my staff, an independent, unbiased report. It reads, put Valley View on the market to determine the level of interest in purchasing the facility and a nursing home license, or in purchasing the license and leasing the facility, whatever. It is possible that significant changes could be made to justify continuing to maintain Valley View as a county operation. You could do either, one or the other. But the odds are long, and the barriers are significantly stacked against a viable possibility of maintaining county ownership at a politically feasible level of Orange County contribution. If the county were to decide to continue to operate the facility, a number of changes should be made, and some of those should be made anyway, for as long as the facility remains in county hands. But in the meantime, we recommend that the county make a decision to create an RFP designed to determine whether there are interested buyers for the facility and at what price. Well, we did that. We listened to them. We started the RFP process. Legislators were on the committee. A few of our people were on the committee, and we decided. And we had 4 buyers come in. And they interviewed every one of them. And I'll tell you in a minute the travesty of one of them, but that's okay. And we had substantial offers that were all very good. Other counties were shocked. They couldn't believe we had 4, and they couldn't believe they had 4 at that amount of money. But we did, because we have a great facility. In the report, unbiased, to the legislature, considerable changes to break even, but very difficult, or RFP it and see what you get. And then in the end, sell it. Sell it. We thought we were on a track to do that. The vote was supposed to happen in April, then May, then June, then August. The vote never came, because a nonsense came instead. That's a travesty. Even Moody's told a cautionary tale in their June and July 2012 letters. They highlighted challenges. Dependence on economically sensitive sales tax revenues, which we do, we always have, but it's getting a little nervous about that. As I told you, it was 163 million, give 70 down, 60, and we keep about 193 million. So they don't forget, they don't like that. Declining state and federal aid, which is happening. Inability to absorb unanticipated costs related to possible delays with the nursing home sale. Delays. Resulting in significant drain on your reserves. What that means, in 2011, you notice they don't say that about the nursing home. They're concerned about the revenues, and they're concerned about sales tax, but they're not too concerned about the nursing home yet. But now when it gets to 12, in June and whatever, June and July, they're concerned. Just like I would be if I was Moody's. Because we told Moody's on the phone for over an hour that I was on the phone, Joel was on the phone, trying to convince them to keep our rating at 3, AAA. Only 2 counties have it. Only 87 nationwide have it. That saves us millions in interest costs. We told them we were going to sell it. And we were going to do it pretty quick. And then when in July hit, they said, well, you didn't sell it. So now we got to start warning you. Things are going to start happening, maybe. You know what they did to Rockland County this year? They took them down to 1 level above junk bonds. 1 level above junk bonds. You know what that means? I do. The legislature should. That's not going to happen under my watch. I don't think it's going to happen under Chairman Pilmeyer's watch. It boggles the mind, mine for sure, that after all of this, not to mention numerous conversations, briefings, status updates, and more and more and more, that there were still some of those that said the severity of the financial issues that we face at Valley View come as a surprise when I announced the plan to defund Valley View last year, a year ago today, at this very stage a year ago. They all were surprised. Not all of them. As recommended by CGR, we put out an RFP, we got the sale, in order to privatize so we could keep the care. Understand, sale keeps the care here. Sale keeps the jobs here. Sale enhances the care. Sale, the residents don't leave. That's the pluses. It goes back on the tax rolls. And the same quality of care is provided by a non-for-profit or profit because it's done in over 600 nursing homes in the state. It's done with 94% of them nationwide. We have 1,400 seniors in Orange County today that are in a nursing home. 1,400. A lot of you don't know that. The public, I want you to listen to me, public. This is important. 1,400 senior citizens in Orange County today reside in a nursing home. The legislature knows it. 330 reside at Valley View. 330. Of the 30, they're not in the county. 300 in the county. 300. 1,100 everywhere else. You know where they reside, ladies and gentlemen? What do you think? In a not-for-profit or private nursing home. So let's look at this scenario. If the inferior care is there, I don't think so. Have you ever got a call from the 1,100? I've got very few. Have you? Honestly, have you? 21 legislators? I don't think so. If we say it is inferior, isn't that a knock on those private and not-for-profits? I think it is. To say you're providing unfair care? No, it's not happening because it's not true. It's not true. We received 4 strong proposals. 4. Not 1, not 2, 4 strong proposals from experienced operators in nursing homes in New York State. They were willing to meet all our conditions. They agreed to maintain Valley View under their ownership for a minimum of 5 years. One made an offer that would stop the bleeding October 1st. You understand what that means? Today is what, ladies and gentlemen? It's Friday. We have Saturday and we have Sunday. And then guess what? Monday is October 1st. And we had a buyer that said just this. I'll stop the bleeding October 1st to this county. What that means is this. It costs us $52,000 a day. Loss. $1.5 million a month. Loss. They said they would take it over October 1st. Under receivership, if we got that approved by the state of New York, I swear to you we would have got that approved. I've spoke to the health department 4 times already. I think we had a very good shot of getting it approved. Because they know at New York State what's going on in all the counties. So I would say, Governor, you're not going to help Orange County get out of the financial burden? Why not, Governor? Why not help us save $1.5 million a month? Why not? That's what you've been talking about, saving money. So help us make that happen by giving the receivership to that company. That company happens to own, ladies and gentlemen, members of the public, 17 licensed nursing homes in New York State today licensed by the state of New York. Say they're not qualified? Who says it? They run 5 other ones under a management contract. That makes 22 to me in the state of Iowa. To say they're not qualified? You gotta be kidding me. You've gotta be kidding me. And at the end of the deal, he was gonna write us an additional check for $18 million to the county of Orange. I wish you made out that document again. Do we get that? That's why it's important this is being taped. That's why this is important it's going on our website. That's why important this is going on YouTube. That's why it's going viral, because everybody's finally going to see the truth. And then we'll see what calls and who gets the calls. $52,000 a day loss. And I'm almost done. In our own efforts to stop the bleeding, over the years, the county, working with Valley View Management, has implemented cost-saving measures. And I'm going to read them off to you, because somebody just said, we don't do anything to save money. That's not true. $702,000 per year in laundry services. $290,000 a year in reduction of housekeeping costs. $170,000 annual savings in utility costs through Mega. $101,000 savings on barber and hair cutting. And $25,000 in consolidated purchasing costs. Ladies and gentlemen, that total is just over $1 million. And we're still looking. And we are still looking. Just for the comparison, a private facility could save an additional $1 million a year in purchasing commodities alone, because they're free from the restrictions placed on government facilities. And what did this all get us? What did this get us? Nothing but grievances, complaints, and resistance from the union. That's what it got us. Save $1 million, keep us open. When we did it, nothing but grievances, complaints, and resistance from the union. And I get it, because it's their job. But don't give me the nonsense, it's the residents. It's the jobs. When there was a rally a few weeks ago, there was an employee there on camera, on tape. And know what she said? I'm here to save my job. And I would be too. But I told you, if you sold it, the jobs will be saved at a lower salary. But their job would have been saved. We also look for ways, and the management team look for ways to generate revenue. Just one example. 30 long-term beds were converted to short-term rehab beds in 2010. This initiative alone resulted in an additional $1.2 million in revenue. $1.2 million in revenue. By something that the management team did. The critics are against the management team. This is what they did, working with us. Because they're critics again, and there'll always be critics. And there'll always be wannabes, and there's wannabes in this room today, and you know what wannabes are. They want something else, or the next job, or whatever. And they're in this room. Let them listen loud and clear to wannabes as well. It takes an awful lot to stand up here and be a county executive. Don't forget it. However, despite the many initiatives undertaken, the reality is this. A public nursing home model is broken in New York State and in the nation. I wish it wasn't broken. It is. I don't fault the union for what they have, negotiating these packages over decades. But that's not the normal traditional pay in nursing homes or the benefit packages. They're not. Yeah, when we were flush with money and we didn't have tax caps, and we didn't have mandates, we could do it. We can't do it any longer. That's the frustration, I guess. The state and federal government simply is not providing adequate reimbursements. Following another CGR recommendation, we asked CSEA to make concessions, to consider givebacks in order to ease the situation at Valley. I invited CSEA leadership to meet with me. We met a couple of times. There were some legislators in the room. We had a frank discussion. We tried to find places we could save, but it was minimal. It was $1 million or $2 million. We said that, we relinquished that. But it's not enough. It's not enough. In spite of the sound recommendations contained in the report, CSEA offered confusing generalities, quite frankly, little of amounts to savings. When you look at the big picture. Instead, they pushed for the start of collective bargaining immediately, which we did. It left me speechless, because I'm going to tell you what they asked for. Going forward, 5.55%. Are you kidding me? 2 weeks ago, they lowered it to 4.5%, 4.5%, 4.5%. 2 weeks ago. Thanks. Are you kidding me? A doctor's note. Don't bring it in till after 10 days of sick. 10! Then a doctor's note. Are you kidding me? What business does that? What government does that? We're not going to. Guaranteed no layoffs at Valley View. Are you kidding me? Have they heard the discussions? Have they seen the reality? No layoffs at Valley View? Are you kidding me? I did that for 2 years too long with 40 people. Because I felt for them. I should have did it immediately. I didn't. But I'm the guy that doesn't care. It's nonsense. To think that this is what we're asking in this economy? Where is the reasonableness? Where are the givebacks? Come on, union. Let's face the realities. For comparison, let me tell you some of the agreements we were able to settle within the last year with other collective bargaining units in this county. The Superior Officers Association ratified a contract that agreed to no wage increases for the year 2012 and 13, as well as health care contributions of 14% by the year 2013. The Deputy Sheriff's Police Benevolent Association unanimously agreed to no raises for the year 2012 and 13. Health care contributions that will increase to 13% of the premium for members who currently pay health insurance effectively December 31st, 2013. And then all members, new and old, unheard of in history. Never happens, ladies and gentlemen, tell you. It goes forward, it doesn't go back. But this one went back, I was shocked. They will contribute 14% of their health care insurance premium, regardless of years of service, a critical element given to the rising cost of health care. Two other unions in this same county, 0000 health care, CSEA 555, no layoffs. Are you kidding me? But we want to help to save Valley View. Even Governor Cuomo himself was able to get the same CSEA union, the same one, the one that sanctions this one, agreed to 2 years of 0%. The very same union. The governor gets 0-0. What do they want here? 5-5-5. Then, in the midst of all our earnest efforts to preserve the care and service of Valley View, certain members of this legislature, certain ones, who clearly did not understand or chose to ignore the years of information provided, as well as their own resolution regarding a fiscal crisis among public nursing homes in New York State, chose to launch a special investigation committee to gather information, to collect facts, in order to determine the best way to proceed. Very interesting. All of a sudden, 43's in the government. Very interesting. At a cost to the taxpayers, just so taxpayers know what it cost you, of well over $100,000. And the number's still being computed as we talk today. So all the information they had, they want to do their own investigation at a cost of over $100 grand to you, the taxpayer, in a time of economic crisis. This committee was anything but unbiased, and if it was, I've had no issues. It wasn't unbiased. It was not unbiased. Let's talk reality. And I'm going to give you a couple comments as to why it wasn't, not just my opinion. They knew from the start where they wanted to go. They knew the fact that one member in the committee sat on this very stage and said, that's why we're all here today, to save Valley View. Oh, no. They were up here to get the facts and the information to pass on to 21 members of the legislature to make the determination, do we save or not Valley View? But the unbiased person on the committee of 5 said this. That's why we're all here today, to save Valley View. That's unbiased. Are you kidding me? That's what he wants to tell you. That's what he wants to tell the Times Herald Record. No, that's biased in my book. Another committee said, committee would redefine the role between the legislative and executive branches of government. Really? I thought the charge of the committee was to talk about Valley, not to talk about the role of the two branches of government. But that person also was unbiased. Nonsense. You want to talk about the roles of the branches of government? Do that another day. Do what they were supposed to do. Information, facts, and give it to 21 members of the legislature that make that decision, not 5. How does it fit in the role? I don't get it. They brought forth witnesses who delivered opinion and conjecture, not fact. They informed the president was never a fact check. Nobody ever checked the facts. Nobody. Nobody on the committee, nobody in the press. You didn't check their credibility or their knowledge. The credibility of many witnesses never ever established. Many thousands of dollars were spent on this committee to issue a report filled with opinions, generalities, and vague findings. The lawyers were the only one who made money here, were the lawyers. They made money. No question. And I said that from day one. The only people who are going to make money in this is the lawyers. And they did. A lot of money. Not the residents of Valley View. Not their families. Not the workers. Not the people of Orange County. Not the taxpayers that pay the bills. They didn't benefit. Now we find ourselves even further in the hole. A strong contender to purchase Valley View walked away. That deal I told you about, the 18 and the $1.5 million a month, he walked away. He's going, see ya. You know why? He said, I have a business to run. And I'm not going to let the nonsense in the political ongoings wreck my business. See ya, I'm out. So now we're left with 3. I'm not saying they're not good ones. I'm saying one walked. And you heard what that walk meant to this county. Tremendous amount of money. Caused by indecision only. Nothing else. What I want to submit to you today, I deeply regret. As I stated before, this issue is bigger than me. It's bigger than the legislature. It's bigger than the employees. And I in no way fault the employers for where they are here today and why they're listening. But the inaction of some legislators has forced my hand. We no longer have time to delay. And those legislators are 9 in number. 9 in number. You figured the 9 out. I won't have to tell you. You figure it out. I know who the 9 were. Very simple. The time has come for me to make even a tougher decision, and I was elected to make them. By the people. By all the people. And those people will determine again. But that is, I guess, shortly. I think a record speaks for itself. And yeah, I have to make these ones, and then I have to make some real hard ones. Some of them I don't like. I always have critics. Everybody does. We'll always have wannabes. Everybody does. That's fine. But I will do what's right for the people of Orange County, just like I have for the last 11 years. Always foremost in my mind. The proposed 2013 budget includes funding for Valley View for just 1 month in 2013, as well as all the legacy costs that are associated with that. That's about another $5.7 million. In order to protect the financial, fiscal health of this great county, in order to avoid another step towards bankruptcy, a very real scenario for some of our neighboring counties, and not for us. 9 legislators have forced me to begin the necessary process to submit a closure plan to the state of New York for their approval, effective immediately. This is not the budget I wanted to present today, but I was left with no choice. If we continue in the direction we've been heading, we will severely hamper our ability to support other critical needed county programs. It is my responsibility to do what's right for all the people of Orange County. There is talk out there of counter proposals that will allow us to maintain Valley View. Some legislators have suggested revisiting the sales tax agreement with our 42 municipalities, leading, I'm telling you, to their bankruptcy. Don't do that. I won't support that. But there's talk. I can tell you what that means. There's $20 million that goes to the cities. You can't really touch them. They're in the agreement. They can tax their own money, but they won't. So you can't really touch them. It leaves the other towns and villages. And here's what happens to them. So you understand and hear it. So the supervisors in the room, you better hear loud and clear. There's $50 million left that they share. Some of them get a lot of money, millions, to balance their budgets. Without the millions, ask them, they'd be in bankruptcy. I won't allow it to happen. If you need 20 million out of 50, that's 40% of the 50. Unconscionable. Don't do it. Supervisors, you should rally against the sale of Valley View, not stand there to keep it. Reducing support to our cities, leading to their bankruptcies, if that agreement got different. That's unacceptable. Reducing staff from all our other departments. I can't imagine our county will even run, because that number's 306 people are cut from all the other departments when our staffing is already cut to the bone. If you look back at that chart, since 2008, we've lowered the amount of employees in this county 313 people, because we had to tighten our belt. 08 to 012, we reduced 315 or 18 people in this county workforce. So to say we didn't do anything, we did. To reduce it another 300 would be a travesty. And we're not doing it. Closing county departments? Maybe we can have one DMV location in a whole county, like many of the other counties do. You wouldn't like that, Donna, would you? And I know the public wouldn't like that. We already have one down that we don't like, and we're looking to relocate. But imagine one. If it was in Port Jervis, or Middletown, wherever, or Newburgh, and you had to travel from the county to get there, figure that out. Maybe I'll just let the state take over the DMV again. They do it in other counties. And we'll walk away. And you'll lose another 100 jobs. Real smart, right? In the worst economic times, put them on the unemployment roll. Real smart, right? Eliminating support for all the non-for-profits to do our work, the county work. Cutting back on the maintenance of our roads and bridges. Let them deteriorate, sure, why not? Raising property taxes by double digits. 70% tax increase. And know who does that? The legislature. Go ahead. Go ahead. And depleting the surplus and bringing this county to the brink of bankruptcy. None of these are especially appealing options, in my opinion. And listen to me loudly and clearly. Raising taxes and taking a step closer to bankruptcy are not options that I will ever, ever, ever consider as your county executive. Call the legislature. Start talking to the legislature. I believe with all my heart that Orange County is by far the greatest county in the state of New York and the greatest place to raise your family and to work in and to live here. My home's here. I pay taxes here, which I'm proud of. And I was born in this county, and I'll probably die in this county. And there's nothing wrong with that. But we've got to be able to afford it in this county, or that all goes out the window. Your sons and your daughters and your grandchildren deserve more. Stand up and make the hard decision. And trust me, don't let politics play in this. That's a travesty. Yeah, there's politics in 10% of this nonsense. Not in this decision. Not in this decision. And you'll all get reelected, trust me. Do the right thing. And sell the right thing. It's hard for one guy to say it. That's hard. If 22 of us said it and laid it out to the public, then it becomes a lot easier. And if just 8 of them want to fight it, that's fine. Because then we need the other 13 to speak up and let the 8 float out there on their own. Go ahead. And you know who those 8 are. That's very simple. And you'll raise the taxes. You'll put us in bankruptcy. Not us, not 13 of us, and not a county executive. 8 of you. You'll put us there. So the public that are hearing me today, call the 8 of them. The ones that are doing this for political gain only, because they think maybe we're going to beat Diana next time. Don't be so surprised. I'm the county executive, and I intend on being the county executive. Not for much longer, but at least 5 more years. I urge you to do the right thing, ladies and gentlemen, for our families, our friends, our neighbors. I need approval of this budget, just like the other $6 billion that you approved. What's so different? I know what's different. You know what's different. It's called November 2013. I know what's different. And I told you, good politics, nonsense 10%, 90% good government. Live by that motto and do the right thing. God bless you. God bless the greatest county in the state of New York. Have a great day, everybody. Thank you.